Okay, today is January 23rd. We're here with Dr. Sandy Ross, who's a PhD in holistic health. And I've known Sandy personally from meetings. And she called emergently this morning, in fact, got me out of bed. And what was the reason?
I'd had a terrible fall 2 days ago where I'd actually upended and hit the wall with my head and the shoulder and my hip, ribs. It was a very bad fall.
And how did you feel when you walked in the door?
When I walked in the door, I was in extraordinary pain. I mean, I could barely move. I could barely talk. And I knew that Robert was the only one that could fix it.
And I didn't even want to see it, did I? Didn't I tell you on the phone to see a chiropractor?
You did, and I'm glad I didn't follow your advice. Because it would have just moved it, and then there would have been more pain, and then the pain would have come back. And so what we did here was what I was angling for, was to get rid of the pain by using your various prolozone and your neural therapy and that magnetic pulsar we just tried.
Pulsating electromagnetic fields.
The difference is unbelievable. And I knew that it was the only thing to do because it's a chronic problem that was totally exacerbated by the fall, and therefore I needed to have something that would be short-term and long-term.
Sandy, when you walked in the door, you looked like death warmed over in terms of pain. I'm almost sorry I didn't video you then, but for the viewer, I just want the viewer to know I'm not used to doing these therapies on acute conditions. I'm used to doing them more on chronic conditions. And you felt you were in acute pain, total body pain, especially in your spine and your low back, and even numbness down your legs.
Right, and I could barely talk because the pain was so bad. When the pain is really deep like that, it's core, is what it was.
Yeah, and so I want the viewer to know that the first thing I did with you was I did a treatment called neural therapy on your back with a homeopathic called Traumeal, which has arnica in it. And this was superficial injections right into your epidermis, and I ran your spine, and you got significant relief from that, correct?
Yes, that broke the pain. It started it on its way, and it gave a jump relief.
And then the next thing I did was prolozone at T9, and then around L1-2, and then your SI joints. And what happened then?
Well, the T9 was, I think, the key. I mean, I suspect that the SI joint was what was throwing things off, but the T9 really, I could feel it. It was deep. It went really deep into my body, and I could tell that it was just going to the areas that needed to be cured.
And then I finished you off with pulsating electromagnetic fields. How do you feel now? If you came in here with 10 points on a scale of 10, I mean, which was absolute misery, I would say you were 10 looking at you, beyond 10.
Yeah, it felt like it.
What would you say now?
Except for sitting in this position in the chair, which is still a little uncomfortable because it's at right angles, it's certainly down to a 2. And I think if I was standing up, it wouldn't even be a 2.
Okay, can I see you stand up? Yeah. Wow. Walk out the door and back. Okay, come on back. I got to tell you, I'm shocked.
I couldn't have done that before. I really couldn't.
All right, well, you can kiss me on the cheek after I turn this off. May I post this on YouTube?
Absolutely.
Can I show it to OHM?
Of course, show it to the guys and girls. I'm sorry I can't be there, but I'm there on video.
Thanks, Andy.
Thank you.